Going to like the GPs or hospital when you're like really young or first time, it can be quite scary, I think. And when I go to see my GP or my consultant, I'd like to feel a bit more welcome. So like just a general, hey, how's it going? Just friendly relaxation. I think you can feel quite anxious, and if your doctor or your nurse was more friendly, you'd feel more comfortable, and I think it's easier to communicate with them.
So lack of communication from the doctor to the patient would make them just feel completely isolated. I'd feel like the GP didn't really care much about it, so maybe it's a problem that shouldn't be looked at, or maybe it's not as important as I thought it was. Afterwards, I'd feel like, okay, then if there's a problem, I won't bother going to see the GP because it's clearly not that important to them, so it's nothing worth worrying about.
You want them to fully feel like this isn't talking to a machine or a computer that just you put in your name and details and they come out with, here's your pills and this is the surgery you need. You want someone who can actually have a conversation with you that you can enjoy talking to.
I think like actually just explain things to me, because when I went, she just like printed out loads of sheets of information from patients.co.uk and she's like, just go home and read this. I think it would have been better if she just explained it to me. I know they are really busy. I know that the consultation is probably about 15 minutes, but I'd like to be able to have a proper conversation on there, not feel like I'm just rushed out.
And also not using really difficult terms which we don't understand. So in a way trying to make the language that they're using appropriate for us.
When you go to a GP surgery, often the case is you're just sat in a chair with them opposite you and they're just dictating loads of procedures and treatments that are available, but maybe a better way to do it would be just like writing it down, what each choice involves and what it would mean to the pros and cons of each one.
From a young age, if I went to the GP with my mum, it would always be the GP talking to my mum, me being left out and saying, oh, she could do this, what's happened, is she okay, what's her so-and-so like, and I'm right there.
I think it should be my mum and me, because sometimes the doctors mainly talk to my mum and I don't really know what's going on. But if they talk to me and I don't really understand at the time, then I could ask them more questions about it and they could explain it to me better.
The relationship with a healthcare professional when you've got a young person and a parent is one that should be transitional. It's not about suddenly offering the young person an opportunity to come in on their own. It's about planning for that in advance so it doesn't come as a surprise either for the young person or for the parent. And not every young person will make the same choice. I think a lot of healthcare professionals automatically think that just as a young person's getting older and towards adolescence and moving on, that they will automatically want to come into consultations on their own. Many do, but it's about having a choice about whether they do that or not.
I think it's quite a small thing, but I have hay fever, so I was asked, do you want these tablets, do you want this spray, and it was just letting me choose what I think's best, because I've had certain tablets which just don't work and whereas other ones work better for me, so it might just be an individual thing.
When a young person is diagnosed with a condition or undergoes a traumatic incident, it can be very disorientating, and quite often in those circumstances, be it medical or surgical, you find that young people are finding a lot of control is suddenly taken away. And they've come from being perhaps a 14-year-old with a great deal of independence who's used to going out on their own with their friends, and suddenly is having somebody, washing and dressing them and making decisions about their bodies in a snap judgment.
You always get that feeling of the doctor's in charge, because you don't know much about what they're talking about, and if I don't know very much about the illness, I wouldn't feel very much in control. I'd feel like I'd look for the guidance all the time.
I was in one time and they said that they wanted to just have a check-up and talk to me about stuff, and then when I was asleep they decided to put a cannula in my arm without telling me. And then they did it wrong, like it popped the vein, and I got really panicky because I didn't know what was going on. Like, I wasn't aware of the cannula going in, and I just got really, really scared.
To not have control can alienate them from the whole relationship. They can become disengaged with the treatment and they may not be compliant with either medication treatment or a lifestyle choice, and can ultimately lead to behaviours that may impact adversely on their health.
So it is so important, I think, for a doctor to tell you exactly what you have, where it's originated from, just a bit of history about what you have, so you're left with no questions unanswered. So you're going away knowing exactly what you have, exactly how to treat it, if there is treatment, the timescale in which it might take for it to clear up. So you just have, so you know what's going on with your body.
I think some people might think, oh, don't worry about telling them because they're too young, but I think they understand, even the younger ones, they understand if you explain in simple terms. So they should know, they have the right to know, it's their body.
What the doctors could do towards the end of a consultation to check you understand is ask the patient, does anything worry you? Does it make sense? Is there anything you want me to go over? Or ask if there's any questions, and then kind of have a recap on everything, just kind of like bullet point main things from there. And I think that would help.